I'm Matt. I'm from Nova Scotia. I'm from the east coast of Canada. I tend to talk fast compared to people from London, so I'm going to try to slow it down. I apologize if I slur. It's an east coast thing. So I am going to talk about developing a culture of analytics. It is something that I'm passionate about and have spent the last 5 years in Nova Scotia doing. At the same time, it seems like a significantly less technical talk than I've heard some things today, particularly the talk at noon from a much more advanced chief data officer than myself. You can tell that he was one of the original 4 and I am one of the later 4,000. So before we start talking about analytics culture, I think it makes sense just to ground ourselves in what organizational culture is. I should also profess I'm actually not a culture person. It's taken me a very long time to warm up to the idea that organizations have culture, and that as a result, I actually think I'm a really good person now to try to preach them forward. I think that trying to fight against culture or trying to deny that it exists ends up being really challenging because you end up pushing against a wall that you don't see. So culture is the soul of the organization. It's how the organization interacts and treats its employees. It's how they know how to interact with each other. We've heard already today different people talk about the impact of culture on remote workforce, in-person workforce. This is no different. I'm not going to address remote versus in-person, but I hope you can apply some of what I have done. I'm also not really going to give you a cheat sheet. I'm going to talk about what I did. It worked really well for me. It worked well for our organization. Ideally, it would work well for some of you. You can ask me afterwards, if I could distill it to 4 steps. But I am just going to kind of walk through 5 years of actions. So in order to actually start to create a culture for analytics, you do in fact need to have a vision for where you're going. In many ways, I think my job creating a culture of analytics was really easy because I stepped into an organization that didn't really have analytics. It had no vision for analytics, didn't have a workforce for analytics, so the bar was really low to work from. So we do have a vision in Nova Scotia Health. It is enabling an organization where data is core to every decision. And our objective, because there is so much data in healthcare, is really to make sure that we can translate all of that data to insight. So within healthcare, I don't know if it's consistent in the NHS here or not, people tend to like to poo-poo data. They like to say, it can't be trusted, it's no good, we can't use it. I would call them on that and say that's actually not true. But absolutely, we are very poor at translating it to insight. So it's not necessarily poor quality, it is definitely often driven by poor insight. And so within Nova Scotia Health, we pride ourselves on being able to take the reams and reams and reams of data that we have and translate it into actionable insight, actionable decision-making for executive. So within our team, one of the first things that became obvious was, A, we didn't have an analytics model, B, individuals didn't know what they were responsible for. So I should also clarify, when I took over my job, there were 9 people across an entire province. We have provinces. I don't know what you have in England or the UK. The US has states. So we had 9 individuals supporting an organization of 27,000, a revenue of 2.2 billion. And those 9 people didn't necessarily know what they were doing. They were good at analytics, but they didn't have a consistent approach to what analytics was. They didn't necessarily have like a description around their job that would say, do X, Y, and Z. Primarily, they took Excel sheets and they sent them to other people. Again, the bar for moving things forward was not at the highest, so although I like to think I did a good job, at the same time, maybe somebody else would have really rocked it instead of me. But we developed a specific analytics model. We worked really closely with IT. So that was one of the other things within Nova Scotia Health. Analytics sits under quality sustainability. It does not sit under IT. I like to think that we have a very complementary skill set, but we also have very differing ideas around the philosophy of access of information, how to share it, how to use it. And so we worked closely with our partners in IT, defined a specific model, broke it out by responsibility for analytics on one side and predominantly IT on the other, and then worked with our staff to understand what their roles and responsibilities would be, primarily in the world of analysis, governance, and then kind of sharing across the organization, promoting the overall idea of data fluency, developing specific courses to try to bring our executive along so that when we share information, they actually know what we're talking about. So 7 years ago, 2015, pre-pandemic, back when everything was just fine, motoring along, this is where Nova Scotia Health was. Primarily Excel spreadsheets, primarily descriptive statistics, and primarily nobody cared. Send out reports, maybe they get read, maybe they don't. One of the first things that I did when I got my job was actually stop sending every report just to see what would happen. We sent 300 or 400 a month. We didn't send 300 or 400 for 3 months, and maybe 7 people out of 27,000 called and were just like, where's my report? Just like, okay, so value add, not there. Value proposition, totally missing. But we employed 9 people, and so that's not an insignificant amount of comp, maybe about $500K, clearly could be used differently. And so we started to think about, so what is it that we should actually be doing? If looking backward and sending reports isn't working, then we clearly need to be doing something differently. So moving into diagnostic analytics, so why did something happen? Again, in my organization, the why was primarily led by physicians or clinicians who just knew. They went with their gut. This happened because, or we know next month something's going to happen because. We've heard a lot about AI. There's a lot within the world of AI right now that helps us understand diagnostics, particularly in healthcare. So you can drill into a problem and learn why it has happened. But that still isn't really very useful. Like it's important, but you do have to be able to move forward. We need to be able to start to do prediction. So again, machine learning, predictive analytics, and then eventually getting into prescriptive or cognitive, so making it happen. So in healthcare, the move towards precision medicine, the move towards individualized medicine, trying to make a specific outcome happen for a specific person is well within reach. We have decades and decades of row-level information on each and every visit, each and individual diagnostic test, more than enough to understand the interactions and intricacies of medicine. But then you need to build a workforce around who can actually leverage that and put in place technological infrastructure to benefit from it. I would also like to call it that I don't have a clock. So if somebody wants to time me, it'd be awesome. Within Nova Scotia Health, I threw this in just to kind of level set. So 2015 started basically no analytics. Decisions weren't driven by data. They were primarily driven by gut feel. We're now closing in on corporate adoption, so getting to a wide range of end users. Analytics is beginning to transform how we do business. All of our executive meetings, so begin with review of corporate dashboards, review of most recent information. You cannot approve a business case without having solid analytics underneath it. And as a result, we fully expect to move into a fully mature environment by 2023, 2024. We had originally aimed for 2025, and that was really just throwing darts at a board. One of the ways that we've started to make this happen, and I think this is essential, so whether you are in finance or healthcare or construction or some other tech sector, having an overall integrated strategy is essential for building culture. We're able to pull in all of the different facets of our healthcare ecosystem into one singular roadmap, and then ultimately also one underlying enterprise data warehouse or data lake. So these represent kind of the different major lines of business that are undertaken in healthcare for Nova Scotia. Pulling them together is more about building the culture for our external users. So the internal users I will talk about afterwards are kind of our own team, but helping our external users understand that there's going to be one spot for all of their information and that they're not being left out was essential. So early on, it was easy to see where we had specific departments who thought they weren't going to be represented and so started to go off on their own. Pulling it all together in one single vision really did help. So this is an internal slide. So this is, and I don't know how many of you are analysts or work with analysts. Analysts don't tend to like to give up their data. Tends to be something they hold near and dear to their heart. And so a major part of shifting the culture for analytics in Nova Scotia Health was shifting how we think about data. So thinking about it as a utility versus a luxury. So it's not supposed to be locked down. It's not supposed to be kept under lock and key. It's not supposed to be, it does need to be private and confidential. We do need to have some governance around it. But within Nova Scotia Health, we are starting to treat it as a utility. So people will throw around the terms democratization of data. We are fully buying into that, trying to make it available to the entire organization, recognizing that most of the organization is smarter than me, And if they have access to this information, they're going to be able to make better decisions. And we're going to come across insights that we didn't expect. Again, early in the morning, we heard from one of the panelists talk about the fact that if all you have are homogeneous individuals, you're going to end up with consensus. You're not going to come up with different ideas. When you treat data as a luxury and you lock it down to a core set of analysts, you will never get the heterogeneity of ideation that you need. So just a quick note around building a culture. Sometimes to build a culture, you also have to adapt your workforce. So when I came into my role, I had 9 individuals. I now have 50 or 60. But of those original 9, I have only 3. So sometimes you do have to talk and work really closely with your staff and understand whether or not they're going to be able to come along for the journey, see a different vision, buy into a new kind of set of culture that you're building. And if they don't, and if people are in private enterprise, this might be easier, you have to shake hands and let go and say, I'm sorry, but this is where we're going, and kind of get on the bus or go to a different area. Those 3 people, though, are core to my team. So they anchor it, they have the ultimate skill set, they can talk with all the new analysts coming on board. So don't necessarily clear house entirely, but don't keep people around who aren't going to buy into your vision and support your culture. One of the other major pieces we had for Nova Scotia was actually changing the services. So within analytics, it was not analytics at all, it was data extraction, data staging. So a lot of source system extraction, a lot of populating of, I will keep talking about Excel, I'm sorry, but that was all we had for a long time. And the team that I had loved to do that. They did not love going into the world of predictive analytics, applied analytics, working with machine learning. And so again, in terms of both creating the culture within the team, but also within our end users, had to really shift what people thought of as analytics, had to break it away from the term decision support, and had to focus on doing like advanced statistical analysis. I brought on board PhDs in statistics, PhDs in mathematics, and in computer science to actually shift the entire skill set, and focused on that. For me, it's on my right. For you, it's also on your right. Good. Left and right aren't my favorite things. But really building out that skill set on the right-hand side to say, like, this is where we are going. We need healthcare to be driven by smart data, not by gut feel, and not by a hope that an executive is going to review a spreadsheet or a report with 200,000 lines of data in it. One of the other things that we had to do within our team was start to begin to define what the analytics process looked like. I'm going to run through these slides quickly because they're relatively straightforward. And they seem pretty obvious. Get data, analyze data, visualize it. Everybody loves a dashboard. And also, if you can put a map in your dashboard, apparently that's all you need. I'm pretty sure I got my job just because I could make a map. Publishing it, so again, making sure that your entire organization has access to your information is vital. I suspect because you're here in this conference, a lot of what I'm saying makes sense to you already, and you're just like, yes, clearly you should share data. Clearly you should put it somewhere. You should invest in a cloud strategy so people can access it from home, from wherever. None of these things were innately obvious within my organization. So publish it and then collaborate. So again, I find within the world of analytics, there tends to be a lot of analysis, push up a report and then walk onto your next one. Never sit down with your end audience, never actually walk through and collaborate, do that problem solving and troubleshooting and understand how the information can be leveraged to drive smart decisions, drive smart investment. That's been a huge shift for us and has also been really essential. So again, I'm just going to run through these. Part of our team was about understanding how to shift from what we used to do to what we need to do. I also one day think I'm going to write analytics on a shoestring budget because I started with a very small budget. So again, we didn't invest in major technological infrastructure. We did invest in visualization software. We specifically use Tableau, and I will call them out everywhere I go because they are a great partner. And if you don't have a significant budget and you're getting started on this, then you can use Tableau Prep to mimic an ETL process without having to invest in a separate ETL tool. That was really important for us. Depending on the amount of financing you have available, that may not necessarily be the smartest move for you. And I like to show this just because one of my analysts built, this is how to use Tableau for ETL when you don't have enough money to buy a full ETL tool. So instead of doing 3 to 5 weeks of data cleaning and processing all to be able to produce a report, Now we come in the morning, and overnight our server management has hit run on this job, and all of our processing is done and our dashboards are updated. Again, that being said, you have to be able to push information out somewhere. Your executive, so for me, it's all about executive and senior politicians. That's who I work with. Information has to be available to them. Sending an email, sending a PDF, sending a printed report will never work. They need to be able to log in on their phone in the morning to some server-based environment and see something new. It also has to be pretty. Nobody likes an ugly dashboard, and that sounds really facile or facile to say here, but it's true. In terms of actually promoting advanced analytics, it's about distilling it back down to a single page. I often joke with my boss that all I ever do is show red, green, and yellow. Like, go see senior politicians and say things are good, it's green, and then try to explain why it's green and what went into it. It actually makes a really big difference in trying to get people to understand and accept analytics. One of the speakers earlier talked about the need to be able to kind of break that black box of machine learning. So why do you put your, I think it was like your secondary point guard on in your third game of the NBA playoffs? You have to be able to explain that to somebody or they're never going to bite. And so again, being able to distill it to something as simple as a stoplight and then be able to drive all of the underlying system performance drivers and explain them is essential. But it starts with a pretty picture. This is a pretty picture. It's actually kind of complicated, but it's no different than an Excel sheet, right? Like if you actually look through, also this will show you why you don't necessarily want to go to a hospital in Nova Scotia right now, because we run over 100% occupancy. But this actually helps us understand that. It helps us know that our hospitals are over capacity, that we have too many patients waiting, and what they're waiting for and where they're going, so it lets us start to act and change. Again, that information we make available through a visualization platform. Again, not really novel, like we're probably 15 years behind, but we're catching up. But it makes a huge difference in terms of people buying into analytics in the organization. The ability to understand what is happening within the hospital down the road allows us to make better decisions. So within my organization, we run 41 hospitals, 101 community centers, 6 long-term care homes, and public health, mental health, and addictions. And everybody used to keep all of their information private. Sharing it across via a visualization platform has allowed the entire organization to know what their neighbor is doing, not in a big brother type fashion, but oh, they're actually busy. The reason they have a wait list or they're not providing staff or they're not accepting a transfer isn't because they are lazy, it's because they're also really busy. And so it allows us to make smarter resource decisions to share. And again, it all comes back to underlying analytics. So one last thing that I wanted to run through, and then I will stop for questions, is about taking advanced analytics and making it easy for people to understand. So within healthcare, it's really important to know what is going to happen tomorrow, next week, but it's also important to know what is going to happen 20 years from now, because when you start to build major capital projects, you are not building for 5 years down the road, you are building for the next generation, so 20 years, 30 years, 40 years, and you're spending $1 or $2 billion today to do it. So making sure that you design your buildings correctly, put the appropriate services in place for the next generation is essential. And to kind of show you how far Nova Scotia has come from an analytics perspective, we are doing an overhaul of the healthcare system in Nova Scotia. We have a project called QE2 New Generation, which is our tertiary and quaternary care center. It is a multi-billion-dollar project, and the rooms, services, and size are being based off of our own internal analytics department. So being able to say the hospital needs to be this big with these services to serve this many people at this rate, and that just would not have been possible 5 or 10 years ago. And so also, because we're geeks, we use rocket ships when we talk about applied analytics. So we built an entire team around applied analytics. We move away from advanced analytics as a term because people turn away from it. This allows them to understand that we're talking about a core business problem that needs to be solved and that we're going to use a specific type of analytics approach to do it. So we developed a specific team. I already mentioned it was very small. It is getting slightly larger. It's still relatively small though. So brought on PhDs in math, statistics, computer science, and a very unique individual who has a PhD in applied computer-human interface. So again, being able to help bridge some of that technical to human gap. Designed a very specific process around how we use applied analytics in Nova Scotia Health. So again, rather than just having analysts do work for the sake of analytics, coming up with core business problems and then using advanced statistical methodology to solve them, and then bringing it back to the organization from a business or value proposition perspective. So explaining exactly what is going to be resolved, what the return on investment is going to be, why it makes sense to solve the problem using A, B, or C methodology. And in terms of the redevelopment project that I was talking about, we looked at both inpatients and emergency departments. I apologize if you're not healthcare folk, but those are the key things, right? Who comes in the door, how long they stay, and looked at very specific statistical processes for predicting 7 days, 6 months, and then 20 years into the future, and validated that with our key clinical staff so that they began to get trust in the information. Because again, we're asking them to spend billions of dollars to define or to construct new buildings, define new services, and they're doing it on a group of 50 people that they may or may not actually know. And again, turning all that back into a dashboard, because again, people like to see dashboards and they like red and green. And so this allows us to understand what is going to happen now, next month, next year, next generation. And using these simple techniques, and they really are relatively simple, it has shifted an organization away from gut feel decision making to relatively sophisticated statistical decision making without needing to employ an entirely different suite of senior executives who have a background in this. Instead, they can look at this information, they can talk to somebody like myself and understand and have trust in the decisions that they're making. And I would like to think that as a result, Nova Scotia is making significantly smarter decisions with respect to financial investment in healthcare based off of analytics. Thank you.
Okay, thank you, Matthew. Obviously, you flew through so many slides there and so much information, which was great. Anybody watching that who wanted to look at those slides in more detail, you can watch the session on demand via the event app, Brella, which I keep promoting for good reason. But you can take all of that again by rewatching the session. Some really interesting points you made there, and you sort of alluded to some of the questions I've got, or alluded to the answers. How has the organisation, or how has Nova Scotia Health bought into this idea of data as a utility? Clearly there was probably some resistance there, I imagine. Like you said, your initial team went down from like 9 to 3. I mean, is that because they were too protective and they didn't want to share that information?
Yeah, so I would say both internally and externally, I am still fighting that battle. So our executive, so our C-suite, bought into it because they realized that by putting data in the hands of other people, you get smarter decisions. On the internal team, you do end up with turf protecting because there's a sense that you're going to lose your job. If I make my data available to you, do you still need me? The answer is yes, because that means you can then do other more advanced analytics. You can use your time smarter. And so the internal sell is that by sharing, you actually enable your organization. You become an influencer or a powerful person because you're making something available to somebody else. When you lock it down and keep other people out, you do not grow in your influence or power. In fact, people turn away from you and look for somebody else to be able to solve a problem. So that really is the nexus, right? It's explaining that, what's the Care Bear thing? Like sharing is caring, but sharing is power. And you end up influential and people come to you and you just kind of continue to grow.
See, that's a really good point. Excuse me, that's what I was going to ask. You say you end up becoming influential, and obviously that trust has to be gained over a period of time. How do you convince, or how did you convince medical staff that data and numbers were to be trusted? Which because it's something that's really human. You talked about gut feeling, for instance, and so much medicine is is based on that in lots of ways. So how do you get them to forget that training, I suppose, and trust in the data that you're providing? When you said as well, you might be looking like 20 years down the line here and spending billions of dollars.
Yeah, I mean, so it starts by looking at tomorrow instead of 20 years down the road, and by having very specific targeted conversations with influential senior clinicians. So find the head of surgery, find the head of oncology, and share with them, first validate that what happened yesterday actually happened. So share the information about yesterday, share it about last week, and then share your predictions for tomorrow. You don't need to go past tomorrow. And when they have bought in and seen that you're accurate 90+% of the time, then share 1 week out, 1 month out, and accept that it is going to be a relatively long process for them to fully buy in. Because they're not going to go from tomorrow to next generation. But they will go from tomorrow to next week. And if you don't try to change their behavior while you are changing their environment, they are more willing to come along. So if you say, look, this is what we think is going to happen next week, but I don't want you to do anything different. Do what you did today, plan for next week. But next week we're going to come back and we're going to share with you again what we said was going to happen with what did happen, and just keep having that kind of iterative. So physicians work in audit and feedback cycles. So do that, but without asking them to change anything. And then one day find the person who is willing to change and continue to work with that person and allow them to kind of knock the dominoes down.
Okay, all right, good strategy. Now, can you give us any examples of how the analytics you're providing has actually impacted patient outcomes? Like I've seen some case studies from healthcare bodies in the US especially, where they've been able to like drastically reduce wait times or diagnosis times. Can you give us any examples of that?
Yeah, so reducing wait times, reducing length of stay, putting in place supportive services. So again, one of the machine learning projects that we've worked on is understanding what services a patient will need when they come through the door. So when you scan their health card, leveraging all of their past medical visits to understand what services they're most likely to require during their inpatient stay, and putting them in place as soon as they walk in the door. So it can be really simple things like making sure home care is prepared for their discharge. Within Nova Scotia and across Canada, because we are a publicly funded system, there's a tendency to stay in hospital for a long time while external services are put in place, but that is still costly. And so by being able to predict that you're going to go home in 4 days, you're going to need to have a ramp built, we can start that ramp being built on day one. So literally actually having a contractor go to your house and build a ramp. Similarly, you can also, though, do kind of the more complex medical predictions that you're going to require surgery, you're going to do best in a minimally invasive surgical suite, you would do best with this type of medication. And again, you don't need to shrink 3 days off your length of stay. If you can shave 3 hours off 10,000 patients, then again, the lack of wasted resource is incredible.
Okay, any questions from the audience? I think we did have some healthcare professionals in here earlier. Yes, question at the back there. If you can just state your name and where you're from, please.
Hi, I'm Birgit Weilmür from Titan Swan. And as Titan Swan is focused on creating sustainability cultures, and you were talking about creating that culture, then I have 2 questions. First of all, did you set out to look at it from a culture perspective, or did you realize it afterwards when you were looking back at your experience? And secondly, do you communicate the aspect of changing the culture to C-level executives regularly, or is it something that you do kind of undercover?
So I didn't know that I was setting out to change culture. I knew I was setting out to change how the team worked. So I was fresh out of grad school. I had written a thesis on evidence-based decision-making. I looked at healthcare as being not evidence-based, even though we talked about being evidence-based. And so I was very specific about working with my team to say, we are going to be this thing. We're going to do it this way. I didn't realize at the time that is kind of setting the table for culture. And so people will say, culture eats strategy for breakfast. I would have said I was working on a specific strategy that then permeated through the organization. So it got legs of its own. I was very specific with my executive. Again, I didn't use the word culture, but I said, this is how we do things today. It does not work. This is how high reliability organizations do things. It does work. There's this big delta that we have to clear, and this is so we wrote like an analytics roadmap and said like, these are the actions we're going to take over 3 years to go from here to there, and then do a check-in with them every 6 or 12 months about where we are at. often because I need to come with an ask saying, I would like more money, please, because I would like to keep growing this team to do these things. And I do think that touch point, so at least within Nova Scotian healthcare and likely within Canada, I don't know, I think it would work for the NHS, you need to have C-suite support. So your CEO and your executive VPs have to buy into what you're doing because they have to support the business cases and push other lines of business to take it up. So yes and yes, but I didn't know the answer to number one was yes until afterward.
Okay, thank you. That's all we've got time for. Thank you very much. Matthew.
Thank you.
Thank you.